And then the recording and anything else that we reference will be sure to put online on the portal so that you can have access to it after the fact. I also wanted to remind everyone, or actually let you all know rather, that we have another meeting scheduled in here right at 11, so we'll be ending at 10:50 today. I think that should be plenty of time, and you'll get 10 minutes of your time back this morning. And so then Heather will start us off with the introductions.
Great, thanks everybody. So I'm unmuting everybody so that everybody should be able to speak. So just make sure you also unmute it on your phone. So if we could start by going around and just very briefly saying your name, the organization where you work, and your title. And we can, how about we start with Astrid?
Hi everyone, this is Astrid Newell. I am the Community Health Manager for the Whatcom County Health Department and excited to be here. And I apologize that I have to leave at about 10:25.
No worries. Thanks, Astrid. Petra?
Hi, I'm Petra Karpsteinova. I'm with Mom Baker Planned Parenthood, Director of Finance and Business Operations.
Great. I'm just going to go down the list here to make it easy. Pia?
Morning, everyone. I'm Pia Sampaga Kim. I'm a healthy communities specialist focused on opioids with Snohomish Health District.
Thanks, Pia. I have on here just says Family Care Network, so there might be a few of you there. So you guys want to introduce yourself? Oh, I see we got a chat. You are muted. So Jessica Den Blaker was an RN Care Manager with Family Care Network. Thank you for joining us. And then we saw your note, if you unmute, you'll hear everyone in the office. So no worries. Thank you for keeping yourself muted. Okay. Lisa, do you want to introduce yourself? Oh, looks like Lisa Carpenter just joined us. So if you can speak and want to introduce yourself, that's great. If not, no worries. And I think, is there anyone who I missed? No? All right. Well, I will, if anyone else jumps on, we will give them a chance to introduce yourself. Oh, Jessica says Lisa is one of my clinical people. Great. Hi, Lisa. All right. And in the room?
I'm Micah Osteen. I'm a project coordinator here at the ACH.
I am Amanda Robbins, and I am a project manager here.
I'm Heather McGinnis, also a project manager here at the ACH. And we also have several other staff in our office who are participating in the course, but could not make the call this morning, unfortunately, that they are excited to listen to the recording and hear about the work that you all are doing. Okay, great. So next, what we would like to do is if you are able, if you could chat into the Zoom chat, which if you're logged into Zoom, you should see in the lower right-hand corner, I think, of your screen. If you want to chat in your organizing sentence that you've developed in the IHI course, or a description of the project that you're working on if you don't have the organizing sentence handy, and then just chat it to everyone. So make sure it's not selected just to the host Salish room, but to everyone. And while you're doing that, I will do a bit of kind of an introduction to why we're really excited to have you here today. So as you know, so the IHI course on leadership and organizing for change, we at the ACH were really excited to bring this opportunity to our partners in the region. It's very relevant, of course, to the work that we're doing through the Medicaid Transformation Project. And we were excited to have the opportunity as staff to participate as well. So I think there's about 9 or so staff members participating. And we're really looking forward to having the opportunity to use the framing in the IHI course to apply to the work that we're already doing, as well as new projects and strategies that have been kind of on our wish list for a while that we can apply these principles to better strengthen our collaboration and partnership and organizing with our partners. So anything else you guys want to add about the course, why we're excited? No worries.
No,
Great.
I think that covered it.
Okay, great. And we also have Lindsay who just joined us. Lindsay, do you want to introduce yourself? Just say your name tag.
Hi, I'm Lindsay, project manager here at Sound ACH.
Great, thank you. All right, I see that people have chatted in their organizing sentences. That's great. So feel free to look those over. I might just kind of scan over these a little bit. So organizing MAC trainees and their mentors, preceptors, clinical services, care management, CMO, and chief HR officer. By December 1st, to have all active MAC trainees within Family Care Network have any and all documents they have created or contributed to the EMR co-signed by either a certified MAC or a licensed LPN or RN, continuing throughout their entire apprenticeship. Great, until they are certified and medical assistants to the DOH, ensuring FCN is compliant with DOH law. That's great. PIA is organizing Snohomish Health Districts, Providence Hospital, and Swedish Hospital Edmonds to decrease fatal overdoses by improving intervention methods to non-fatal overdose patients in the emergency department, because after an overdose can be a pivotal time for a person experiencing an opioid use disorder by January 2020. Great. Implementation of inventory management system at Mount Baker Planned Parenthood by February. Organizing child health advocates, educators, health providers, and families to create a shared vision, goals, and action plan to increase child mental health provider capacity in Whatcom County. That's great. These are awesome. Okay, so keep chatting those in if you haven't already. I think it's useful for us to see what other people are working on. And I will also chat in mine after I stop talking. Great, so I think I'll kick it over to Amanda to get us going on some discussion.
Yeah, so it's really great to see all these organizing sentences coming in, and I'm noticing a lot of them were coming up really quick on the deadlines you've all set for yourself. And so we just wanted to start off with asking, how is that going? How's your project development going? Any barriers you've hit along the way, and sort of how you overcame those, or just generally what that has looked like for you and the work you're doing. So everyone, I think, is unmuted if you chose to be, and so feel free to either chat in your answer or just call it out while we're here on a call together.
Who wants to start?
So Lisa chatted in that finding time to meet with the group has been the barrier. And Lisa, is that the group of people that you've identified in your organizing sentence as the folks that are part of this project? Yeah. And we might get into this a little later, but I guess a follow-up question for that, Lisa, is do those folks that you are trying to bring along, do they know about the IHI course and that you're sort of in like a catalyst cohort to try and move some projects forward, or is that something that's stayed in your world and you've just translated it outwards to your team that you're working on some project?
She'll be chatting it in.
Yes.
Great. Well, oh yeah.
Oh, they're all in the course.
Great. Yeah. And Petra says, Open School provides a great framework for our project. It's a challenge to stay on a weekly schedule. Yeah, I hear that. And feel free, you guys can speak too. The chat is just helpful if you have like a long piece of text to say, but yeah, Astrid, do you wanna, I know you've reached out to us about connecting about projects. Do you wanna say, how's your project development going?
Yeah, so I'm working I have a personal and organizational interest in children's mental health issues, and there's a lot going on in our community around children and youth and mental health, a lot of prevention work, and one of the areas that feels like we're not organized around is just increasing our capacity around child mental health services. And so I've been reaching out to both internal partners here at the health department as well as community partners around this topic. And it's I think it's an overwhelming topic. And so finding that people are interested, but that I may need to start at a much kind of much smaller scope, particularly looking at doing some kind of an assessment, community assessment around what our service system really looks like for kids and their families around mental health services. So rather than trying to tackle like my original organizing sentence was something about doubling the number of mental health providers with child training in Whatcom County, and we don't even know how many we have currently. So, so trying to find the right scope for the project has been a little bit challenging.
Yeah.
I hear kind of two things, just from Lisa and Astrid, in that maybe there are some folks who have leadership that are readily available to meet and those decision makers at the table, but also there's different levels within the organization that you have to be mindful of in terms of interest and where they're at and knowledge and skill set.
Mm-hmm. Yeah, definitely.
Yeah.
Yeah, I'm developing my organizing sentence too. I was also thinking about, what are goals that we want to do, and have definitely, as we move through internal conversations, have had to pare down a little bit and make it much more specific. But that has been a valuable process in and of itself as well.
Yeah, I almost feel like it's like a quality improvement process in that you write your organizing sentence, take a few steps, and realize you might need to go back and refine.
Yeah.
And then you can take a few more steps and continue tweaking until you've really honed in on what that project is and what it looks like. So I found that really valuable as well.
Yep.
And Amanda, have you utilized the IHI one-to-one coach?
I was paired with someone and reached out, but I never heard back.
Has anyone else used the coaching through IHI?
This is Astrid. I did the same thing. I had a nice initial meeting, and then I reached out and haven't heard back yet because I was trying to figure out how to maneuver this.
Yeah.
Yeah, I had a coaching call and found it was really helpful to pare down, especially when there's maybe a long project or with many phases over many years, trying to focus the project in that organizing sentence around what you can do within the time relative to the course. And I found the one-to-one coaching call is really helpful in that process of paring down that statement.
That's good to know. Maybe I'll reach out again.
Nico, what were you gonna say?
I had a call with my coach, and it was actually really helpful to figure out how my project fit into the whole course overall, because my project is much more internal than some of the other ones. Mm-hmm. And so I found it really useful. And my coach has been really good about following up with me.
Oh, good.
Great, you got a good one.
Great, and then Jessica says, tried for the first time, but the phone system went down. Oh no, technical difficulties. Okay. Got it. Okay. Yeah, anyone else? How about, I don't want to put anyone on the spot, but Pia, how's your project development going?
It's going good. I actually have a meeting with Swedish today.
Good.
I think the thing is that we already have a relationship with these hospitals, and we've already done, so it's a project that has actually continued for the last year, and I'm taking over. And so I'm in the process of realigning it with what is needed in terms of the grant, and then what their focus is, and then also really wanting to do more of a QI along the way to improve the process, because that wasn't done within the last year that they were doing the project. So that's kind of where I'm at. And so the relationships are there. It's right now a little bit of convincing in improving. So trying to, for example, at Providence, we were able to involve the behavioral health team into the process. And now at Edmonds, I've already gotten a little bit of pushback in terms of trying to involve the nursing staff. But I'm hoping that a meeting today can kind of change that.
Great. That's awesome.
And I have reached out to my coach, but I haven't heard a response yet.
Yeah, that's great.
Maybe this can encourage all of us to try one more time, reach
Yeah.
out to our coaches again.
Petra, how's it going?
It's going great. So I took kind of a easier process improvement project because I wasn't sure how much time I'm gonna have to dedicate just to go through the 9 weeks of learning. I did use the 101, but it was more like a group meeting where we each had like set of questions, and then each of us who were not talking were like kind of assessing the individual points in the 101, the things you're supposed to pay attention to. So that was interesting, and then we kind of debriefed after, and that was kind of our like first meeting to start the project. And I think it set the tone and gave us kind of good feedback on what people are ready to commit and what roles they want to have in a project. And so that was good. So we are moving along. We have second meeting in a week, next week actually. And then my one-on-one was with Jim from FCN. We met in a clinic here, and I wouldn't say we like followed the 101. It was just kind of checking in on what we are working on and how the open school is going and the benefits of just being in the program. And we kind of chatted what FCN is doing and what Planned Parenthood is doing, and trying to find something maybe we can work on together, or if not now, then in the future. So it was good.
That's great.
Thank you. Could you share a little bit more, Petra, about, you said there was a meeting where folks kind of talked through their roles and how much time they were willing to commit.
Mm-hmm.
Could you share with us what that looked like and how that went?
So it was meeting of our employees, right? So we felt like we already know each other a lot, but like finance people may not be working daily with somebody who works in the clinic, a nursing staff. And so we try to kind of explore like, what is your role in the clinic? What is your job? How would you describe your job? And how the knowledge and skills, whatever you do at work, how do you think it applies to the project? And so our project is kind of revamping our inventory management system and making it more holistic, something that actually the employees will implement versus, something just like put on them to start using. And I think they like that, and that was part of like getting them excited and getting them committed. Big part was also talking to the managers and making sure that they can, give them the time to meet and work on different tasks. So we kind of talked about the preliminary commitment, how much time, how many weeks. And we set February as our deadline, but kind of agreed like if it's not doable, then, you know, it's okay to maybe start in March or have a different deadlines. Yeah.
That's great. Thanks for sharing.
Mhm.
It's interesting to hear, you know, having it be led from the employee side so that there's buy-in there and continued implementation of the processes that you're going to put into place. Sounds great.
Yeah, and we also had, you know, a lot of changes in the leadership in the health center. So I think that was one of the reasons why, you know, the leadership is new. So we need to rely on the employees who's been with us for a little longer.
Yeah, that's great. Well, what have been your biggest takeaways so far from the course? And this goes to anybody who wants to respond. Biggest lessons learned, things are sticking with you, things that you're going to carry with you after.
This is Petra. I think for me, it was more just realizing that, you know, the concepts I'm already using or I see other people using in like meetings and convenings and like project management, this just gives me kind of nice way to put it all together and make a sense of it. So I like the materials that they are providing. I like the weekly assignments. And I think I'll be probably using them in the future because they just gives you a kind of a good guide.
Yeah, absolutely. Thanks. Others?
Yeah, I just wanted to kind of tag along with what Petra and Amanda were saying around, I like what you said around the continuous quality improvement and adapting as we go and having the tools to be able to learn and adapt, but also creating that buy-in and really creating a space for staff to contribute to those changes as a way to create that buy-in. I think that's one thing that's really stuck with me just in relation to the coursework so far.
Mm-hmm. Yeah.
I've appreciated how they kind of focus a little bit on understanding your story of self, your story, and how understanding why you're coming to the table in the first place really can help foster the relationships and bring purpose to the work that you're doing. I think that when you have passion, it shows through in the work that you're doing, and especially if you're trying to lead a group. If it's ingenuine, then the work becomes ingenuine. And so I really like how they kind of are like, focus on you, so that way you can focus on those relationships that you're building.
Yeah, I agree. That at very first felt sort of counterintuitive to me. And then it was helpful to see in the IHI All Learner call, some folks present their stories and how that ties into their projects. And that really hit home for me after we got to see someone practice that for us.
Mm-hmm. Yeah, I think Petra is kind of along the lines of what you said, but a lot of this stuff they're ideas that are not necessarily like brand new to me, but the way it's presented and the way it's framed is really useful. And it's also just a really helpful reminder that I think as we get into this work, you sometimes move so fast that you kind of forget, or not necessarily forget, but you don't allow yourself the time to take a step back and think, how are we doing this strategically? Are we in line with, you know, what we've learned to make this effective, to build sustainable relationships, to make sure we're doing things the way that we want to be doing them. So I think it's just a nice reminder of like, hey, there are these tools out there that are going to help you make a project be as effective as it can be. So it's been really nice to remind myself of those frameworks and practices.
And they're tangible and adaptable for changes, you know, throughout the course, which I think are really really great that it's not so theoretical that you're not able to apply some aspects of the tool to your work.
Yeah, for sure.
I've also found that same framework to be helpful in breaking down problems that feel really overwhelming. That there's this big problem I want to solve, but where do we start and how do we dive into what the specific need is? So I found the tools helpful for that too.
Yeah.
I shared the first assignment we had, which was the organizing sentence. I shared that with my team, and everybody liked the template so much. They were like, okay, we're gonna start using it now for everything.
That's awesome.
Great.
Petra, are you the only one at Mount Baker Planned Parenthood participating in the IHI course?
Yes.
Mm-hmm.
Okay. And then Pia, same for you at Snohomish? Oh, that's great. Great, just curious. I know on our full email list, I think there was like 20-something folks who had, that we have on our list who are participating. So too bad that not everybody could join us today, but I think there may be other people at organizations that aren't on our list that are also joined on. So just curious.
Mm-hmm. Do you know if anybody's going to the national, the big national conference they're advertising?
Oh, I don't know.
Anybody been to it?
I wish I was going.
Yeah.
You were?
I'm not going, but I wish I was. I don't know if any of our partners are.
Uh-huh.
Yeah.
I haven't heard from anyone that they are.
When is the conference?
December.
Yeah.
There's also another
Yeah, I
one.
think it's December in Florida.
Ooh.
I think it's in Florida.
They do,
I mean, if you guys want to send me, I'm more than happy to go for sure.
Let's all go to Florida.
I do know if there are any last minute people interested in that, they do offer scholarships for up to 50% off of that base price, and then they can provide some support for lodging, but
Oh, that's good.
last minute plan.
Okay. We can look into that. Yeah, that's awesome.
And so moving to another question, we've been thinking about, for us, this work is very tied to the Medicaid Transformation Project, and just wanted to hear from you all how you feel like you could take this work to other aspects of Medicaid transformation that your agencies might be committed to, and how you'll be able to use it moving forward with Medicaid transformation. I know. Go ahead.
I guess the answer is yes, we will use it and apply the knowledge, right? I'm trying to think like some good example or something we're working on right now where it would fit, and I just can't. I have to think about it a little more.
That's okay.
Do you feel like the model of sort of working through this framework would be applicable to other transformation strategies that you're committed to? I guess for me, the way I've been thinking about it is sort of from that big picture perspective when I think about, the three big areas that the ACH is committed to, and then all of the 22 strategies within that, thinking about how we take tangible, actionable steps within each of those. And I find that returning to an organizing sentence and this framework is helpful in envisioning how that change can happen, instead of something that seems big and amorphous and you don't know which side to tackle it from. This, I find, helps me pick a direction, at least find somewhere to start. And then if that's not quite right, reassess.
You're gonna be like your true north or benchmark to check yourself and progress.
Yeah, I think for me, the project that I'm working on is, well, it's directly related to the Medicaid transformation project, but kind of from a big picture level, thinking about increasing collaboration between partners. We heard from partners at the last partner retreat that increased collaboration is something that people are really interested in. So, and we've heard interest in a list of several different convening topics. So I'm looking at that and picking a topic. It's sort of had a lot of interest to think about how can we strategically move forward with having that convening be as effective as possible. And so that's kind of for me how it applies, is sort of helping you all come together to collaborate in your work. Yeah. Great. So some of you mentioned that you're working on this with other folks in your team. I know FCN, you guys are doing it as a group, and some other folks, but for those of you who aren't, how are you bringing this, what you've learned, back to your team? How are you sharing it? Pia, not to pick on you.
So I'm the only one that works on opioids. Well, we have another colleague, but I'm the one that's only working on this project. We have an epidemiologist that I do we're working on this project together. So I haven't really done, like, I've done FYIs to my supervisors and whatnot, but I'm sort of a little bit on my own with this.
Yeah. So
in my agency.
Yeah. So kind of sharing what you learned, but more in terms of like the project that you're working on, not like,
yeah.
Let me tell you some interesting things I've learned today. Yeah, got it. That makes sense.
I mean, I am bringing, in terms of like the one-on-ones and whatnot, Gabby, the epidemiologist, we're going into those meetings together, and so she's kind of involved, but she doesn't know that it's an outcome of this.
Got it. Yeah. I know for us, we talked about was it in lesson 4, where the different ways of thinking about like mapping assets and stakeholders and kind of putting people into different categories. That framing was really helpful for us in terms of thinking about, not only our ACH change plan partners, but all sorts of different organizations and institutions that are kind of in the mix. So it's helpful for us to think about, are there ways that we can kind of categorize and think about different players in a way that makes sense for, building relationships and organizing for change moving forward. So I think that's something we're going to bring back to the bigger group to do that kind of asset mapping, which will be useful.
Yeah, and when, just to add on to that, I think we had brought it to a mid-sized group, the asset mapping strategy, and it was interesting to hear kind of perspectives within our organization on what elements could be taken out or what could be focused on more heavily, depending on the stage of the project that you're at. Meaning, we know a lot of our challenges in the North Sound region already, and we're into implementation, and so instead of focusing so much on opposition and the challenges, really looking at supporting mechanisms and supporters within the community, and further ways to support partners around convenings. So it was neat to see how that framework and that asset mapping can even be adapted depending on the organizational needs and the stage of the project that you're working in.
Yeah, for sure.
So we were also doing some thinking about continuing this work after the IHI project ends. So like I said earlier, just chatting in your organizing sentences. A lot of these projects are happening December this year, January next year. And we're curious to hear from you all how you see this work continuing beyond the end of the IHI 9-week project.
So we're going to continue this process with Providence and Swedish for the next 3 years. So I think my plan is continuously to do QI and take what I'm learning from here. And each time we do a new PDSA, that it's part of understanding why in order to improve. So it's part of the whole project is part of a larger grant that we're doing, and I just am trying to improve the outcomes for that.
Great.
And Petra, talking about the inventory process, do you see either that specific project or a project that might branch off from that coming up next?
Yeah, I think, as I said, I kind of picked a smaller project on just company level. So we are not including other stakeholders outside of organization. And my next step would be to apply this to a bigger project that includes somebody outside of organization and how it's going to work. So that's kind of how I would see myself to use it in the future. And I know we already have some projects lined up where it'll be really kind of helpful to kind of guide them in this way. So yeah, I'm excited about the future projects.
Going back to the one-on-one coaching calls, one of the things I found really helpful in that organizing statement was, I think at first I was approaching it that you have to address all phases of a potential project, no matter how long that might be. And that coaching call helped me realize I could break down my project to, just one phase of a larger picture. And it doesn't necessarily need to be the first phase, but it could be a critical component to that project being successful. And so I think just kind of reminding ourselves that it can be broken down into phases and you don't have to address the entire project timeline and longevity. I found that really helpful.
Yeah, that's great.
I think this is giving me a process because the project I chose is a smaller internal project that I can use with projects going forward and really use it as a QI tactic to go back and see how things are working and edit as needed. And I think it'll be really helpful to have that, those steps to guide me in future projects.
Yeah, I keep hearing QI too used interchangeably, and it's exciting to see how organic it's kind of unfolded it throughout this process with IHI. I don't know that we were regularly using QI terms with partners, and now it seems to be more of a shared and common language, which I think was a success.
Yeah, agreed. I think the way it's framed in this course, I appreciate that they kind of have the dual framing of if you're a clinical organization, think about it this way. If you're more of a community base, you can think about it that way. I think it makes it much more accessible. I think, as we've learned moving through this, for some organizations, quality improvement, especially non-clinical, quality improvement is kind of a big scary term sometimes. And so I think I really appreciate the way it's broken down, and it makes me think about like, how do we share this with more folks to use this as a tool in their tool belt moving forward, thinking about QI. Great. Well, we only have a few more minutes left before 10:50, but we're thinking about kind of next steps. Well, only a few of us were able to join on today's call. We were curious about whether you all thought it would be useful to have another call, maybe, if we did a doodle poll with all the participants in our region around the IHI course to see if we could get another call going to hear more about the work and support each other. So what are your thoughts on that? Would it be helpful to do this again, hopefully with more participants?
Yeah, it's kind of nice to share what everybody's doing in this region around this.
Great. I know Lisa had to jump off, but Jessica, if you want to chat in your thoughts, that would be great. Petra, do you think it would be helpful?
I think it would be helpful. Yeah, totally.
Okay, great. We were also curious about, in terms of getting more direct support and feedback, it's on your project. Is that something you feel like you could use folks in this group to do? I know we have the email list. If we have another call, we could use that as an opportunity to get more kind of one-on-one feedback. Would that be useful as well?
I'm not sure I understood what.
Okay.
Sorry, before I commit.
Yeah, I think essentially we're just curious, like if folks want to connect with other people in the region to get more support and feedback on their projects.
Mm-hmm.
Like the IHI peer support, but
Local
regionally instead of internationally.
Yeah, I think that would be great.
Yeah, I think, if we can kind of maybe reach through you, Heather, to other people who are working on some projects that is like similar to what we are working on. I think it would be good to have that contact. Okay,
great. Well, I think we can move forward with thinking about getting another call on the books and trying to find a time that works for more folks to get more participants. And then
I just want to make sure we capture one of the comments here. I think, part of the difficulty from coming in from Family Care Network, Jessica's, and part of the difficulty being that we don't necessarily know what each other's goals or processes are, but also we don't necessarily know what each other's projects or organizing statements are. And so I think it would be really helpful to maybe even have a form where we can post those organizing statements as we go and adapt them, or connect based on kind of project specific goals or maybe larger initiatives. I'm not sure which one, but
yeah. And I think right now in our partner portal, we have a space where folks can chat in their organizing sentence, but something we could do is maybe share out, once we've seen them all, share them out in subgroups. So something, if there's a bunch of people working on opioids or inventory management like Petra, we could send subgroups so that folks know who's working on things that are similar to their projects.
Yeah. So I think stay tuned for more info. I think we'll probably start with the email list because that's who we know for sure. But we'll send out more details about how you can connect with each other and how we can facilitate that process. But yeah, I think that'll be good.
And everyone is aware of the how to post their statements on the portal.
So I'm not sure if everybody on the email list has access to the portal who's participating in IHI course, but for those of you who do have access, we started a thread in the partner to partner forum section of the portal. I think it's under the Care Transformation Initiative. So we've started to post our organizing sentences, but if you want to go in there and post yours, that's a great place to start as well. And feel free to reach out to us if you have any questions about how to do that.
We can share that too after.
Yeah.
So I want to make sure we get wrapped up on time so our other folks can get in here. We've got about 3 minutes left. So I just wanted to open it up if anyone has any last comments they want to share or things they want to let us all know. Anything else you'd like to say?
I want to thank North Sound for giving us the opportunity. I guess I would never really figure that out myself.
Yeah, this is a great opportunity. So thank you.
Happy to help. We should probably, she has had to leave the call, but we should probably credit Astrid. She reached out to us and was really interested in connecting with folks locally, and it made us kind of go, oh yeah, ding ding, we should probably do that. So yeah. Great.
Well, thanks, guys.
Thank you.
Thank you.
Thank
everyone
you.
for joining.
Yes.
We'll follow up shortly.
Stay tuned for more next steps. Bye everyone.
Bye.
Bye.